A common procedure that we complete in the office is a dental crown. Now, people think of those as caps, covers on teeth. And what a crown does is it supports the tooth. It encompasses it in a hard material to prevent it from breaking, either a cusp breaking off or a piece of filling coming out. Unfortunately, in the past, people have had a lot of fillings in their teeth, and they've then been refilled, and maybe refilled again. And the fillings get larger every time that happens. And when patients come into our practice, we look at each tooth and we make a judgment on its structure. And will that tooth last that way for the rest of the patient's life? Because what we want is for people to keep their teeth. So sometimes we will diagnose this person needs a crown. And the patient response will be, well, why, doctor? It doesn't hurt. And yeah, it doesn't hurt. But sometimes we will look at a tooth and see the size of the restoration or see fractures emanating from the restorations and decide that maybe that tooth should have a crown on it before it becomes a problem. The longer a tooth has a crack in it or a deep restoration that is, say, leaking, the greater chance that tooth is going to become inflamed and require a root canal in the future. And if that's the case, the tooth is greatly weakened. So sometimes we diagnose caps before the tooth breaks. One of our best ways of helping patients understand this is we take an intraoral camera, a small camera, place it inside the patient's mouth, and take a picture directly of that tooth. It is hard for patients to look in the mirror and see problems with fillings or cracks in teeth. But the intraoral camera, we display that photo in the patient operatory on a large television screen, and they can see exactly the reasons why we would say you need a crown on top of that tooth. And it helps patients understand the need for it before that tooth becomes a main problem.